I had a terrible shooting electrical pain that would just jump right out of the top of my head. And it would come and go all day long. It didn't bother me when I slept, but eventually it just got worse and worse and worse. You can't describe the pain. The pain is so intense that it makes you crazy. I couldn't eat. I was using mouthwash to brush my teeth. I went through a number of doctors. That's when I found a neurologist. And then from him, I went on drugs. And then eventually, that's when I found Dr. Jacob, because I had to have somebody help me.
So Maureen came to me with symptoms of typical trigeminal neuralgia and was quite disabled by the pain, to the point that she was even losing weight because she wasn't able to eat or chew or talk or brush her teeth, couldn't sleep on that side, couldn't get shower water on that side of the face. It had really, really altered her life, and she's otherwise healthy, active person. In the great majority of patients with typical trigeminal neuralgia, there's some sort of a vascular compression along the root of the nerve where it exits the brainstem, and that's the target of the surgical treatment. Some other patients are better treated with a ablative treatment, what we call, and that can be done with either focused radiation or radiofrequency or a balloon or chemically. But I would say the great majority of otherwise healthy patients do the best with a surgical treatment to relieve pressure off the nerve.
He explained exactly what would happen to me if I decided to do this surgery, and then he gave me an open-end invitation, and he said, you go home and think about it. So I came home and I thought about it, and I decided to just go ahead and have the surgery because I had the time.
And so we did our operation and did a good decompression of her trigeminal nerve, and she is now pain-free and off of her medication.
I had my surgery in September. It's now November, and I have no issues whatsoever. I can eat, I can brush my teeth, I can talk, obviously. I came home, gained 5 pounds because I couldn't stop eating for like 2 weeks, and I'm totally pain-free. The diagnosis is the hardest part of this disease. It's the hardest part for someone. The best advice I could give someone is to just find the right doctor. Try to find the right neurologist, and then from there decide if you need a neurosurgeon. I was fortunate that I found Dr. Jacob from the Michigan Head and Spine Institute. It's like a little miracle in my life.